Okay, this is the third seminar of the 599J in the winter quarter. And one of the kind of moments I enjoy most as a faculty member is introducing former students. And Sharam was my former student long time ago, 1986. He was in my senior capstone design course called 478, EE 478. And it was probably the most difficult course in UW at that time. And I remember Sharam's project, and I remember him as a senior in EE, and he was outstanding. And now he's a colleague of mine in bioengineering. So it's my pleasure, particularly, to introduce Sharam today. Well-accomplished, well-decorated faculty member now. So he got his BS degree from EE in 1986 and PhD degree in bioengineering in 1991. And he got number of scholarships as an undergraduate student and number of fellowships as a graduate student and postdoc fellowship from NIH for his further training. And he started up his own company as well in somewhere in mid-90. And then he came back to UW again in 1996, and he became research assistant professor in bioengineering in 1998. And last year he became assistant professor of bioengineering. And he has a number of awards, like he got the cover of the Journal of Trauma for Spleen Hemostasis device in 1999. And prize paper award from the Acoustica Society, American Society of Reproductive Medicine. And also his paper was selected for the yearbook of vascular surgery in 2000, best clinical paper of the year in 1998, and etc., etc. And he was one of 3 or 4 invited speakers last year of the acoustics. International Congress on Acoustics held in Italy. So one of 4 invited speakers of the Congress attended by about 2,000 people. So it's my pleasure to introduce Sharam, who will give us a presentation on treating tumors and internal bleeding using image-guided high-intensity focused ultrasound. Sharam.
Thank you very much, Dr. Kim. It was a great pleasure for me to be in EE 478, and thank you very much for not bringing up the big mistake I made in that class, which cost me the 4.0. Okay, well, thank you very much all for coming too. It's wonderful to see so many people here. I guess a lot of you didn't have really a choice and had to come here to get the credit, but I can at least thank you for not choosing this one to miss, because I think you can miss only one. All right. Let's start. Treating tumors and internal bleeding. Oh, by the way, I just saw the back of my head there. And this is, I think, after 2 years that or maybe 3 years that I'm giving a lecture here. So I'm looking forward to seeing the tape and see how much of my hair I've lost in the 3 years. It's going at a fast rate. Tell you young folks, enjoy it while you have it. Okay. So let's start out. And let's start out right. Could we have the lights down here a little bit, by the way? Okay, thank you. Just wanted to start out by warning everybody. If you really don't like blood, you may want to turn your head, because this presentation does contain scenes of injury and blood, so just be careful. So ultrasound, what is it really? This is what my sister knows of ultrasound. She just gave birth to a baby girl, and she had an ultrasound exam, obviously, and this is what it's used for, for diagnostic purposes, looking at fetuses, looking at internal organs, diagnosing diseases and stuff. But this is not therapeutic ultrasound. Therapeutic ultrasound, or high intensity, or specifically high intensity focused ultrasound, which I will be talking about today, is a mode for doing therapy, for delivering localized energy on the order of 1,000 watts per centimeter squared or higher. And with this amount of energy in 1 second, you can create a burnt spot in the tissue. Coagulative necrosis, that's what it's called, causing coagulative necrosis. And you can do this with a millimeter accuracy. So you can see that this could be a powerful tool that could be used for killing tumors, because you can kill the tumor cells, or stop bleeding, like for cauterizing. What I'm showing here, by the way, we'll get into this, so hopefully by the end of this talk, we'll know what this really entails. I'm showing an imaging probe, ultrasound imaging probe, and a HIFU device, high-intensity focused ultrasound device. With the imaging probe, you will be able to visualize the organ and perhaps a tumor in it. And with the HIFU device, you'll focus the sound energy with that, at that level on the tumor to kill the tumor, to burn the tumor. Interestingly enough, the first, one might think that, well, ultrasound imaging came first and then HIFU now. But believe it or not, the first clinical study of ultrasound in medicine, period, was in therapeutic ultrasound, not in diagnostic ultrasound. In 1956, the Fry brothers used HIFU to treat Parkinson's disease patients. Here I'm saying symptoms of patients. What you are seeing here is their setup. This is a picture from the top. You can see the patient looking to the right. That's the shoulder looking to the right, looking at the top of the skull. A piece of the skull was removed because, as I will talk a little later, bone is a problem in terms of propagation of ultrasound. So the piece of skull was removed. A bowl was placed on top of the skull, was filled with water, because water is a good medium for transmission of ultrasound, and lesions, as we call them, those areas of cooked tissue, were produced in the brain, in the specific areas of the brain that were responsible for the symptoms of Parkinson's disease. And it was actually very successful. It didn't quite pick up because a drug by the name of L-Dopa came in market. It was cheap, didn't have to do a lot of this complicated setup, and that picked up. So therapeutic ultrasound and HIFU specifically didn't really quite pick up at that time because of this complexity, because of this difficulty of achieving an accurate and reliable treatment. Nowadays, I believe we do have that capability, and now that's why we have this resurgence of interest in HIFU. In fact, in 1980s, we saw HIFU treatment of prostate with ultrasound image guidance. There are two companies involved. These two companies are still involved, Focus Surgery and EDAP Technomed of French. This is a US company, and this is a French company. They both have transrectal devices that allows them to first image the prostate and then treat the prostate. Now, for different diseases, a couple of them, for example, one was benign prostatic hyperplasia. It's a benign disease. The prostate gets enlarged in men over 50. And another one is prostate cancer. Again, for both of them, what they want to achieve is to cause coagulative necrosis of the tissue, of the prostate tissue, and it will shrink afterward because the body will absorb that necrotic tissue. From 1980s and that type of treatment, now this is a very recent development, MRI-guided HIFU. There are clinical trials right now in the United States by a company named Insight Tech for breast fibroadenoma, breast cancer, and uterine fibroids. And this is their setup. The patient will be lying on a bed that has a hole filled with water. The breast will be hanging in the water bath there, and there's a HIFU transducer underneath which will focus on the tumor. These are MRI images before and after HIFU. Before HIFU, you can see that the contrast agent they have used for visualizing the tumor has been picked up by the tumor quite extensively. That's why it shows up bright. After the HIFU treatment, when you have caused coagulative necrosis of the tumor, all the blood vessels have basically collapsed. No blood can get into it. The tissue is dead. You can see no contrast agent is picked up. This is very recent development. And in fact, even perhaps more, in another way of interesting, is that we could do HIFU without anesthesia. If the tissue is not innervated, if there are not the nerve endings, there are no nerve endings in the tissue, one can do the treatment with HIFU and no anesthesia is needed. The patient is awake, responsive, no incision has been made, non-invasive treatment of tumors without anesthesia. Kind of like Star Trek, I guess. Gail Tahar in England is treating primary and metastatic tumors of the liver. As I said, the patient tolerance is good. There's no pain. They're awake. And they have seen no adverse effects, meaning that no skin burns, no other deleterious effect of treatment, if any. Okay, now let's get to the meat of or the technical part of the talk. First of all, let's look at the frequency. If there's one important parameter in ultrasound, this is what I tell all my students, is the frequency. You come out of the talk and you don't know what the frequency of ultrasound is, you have missed a major point. So, hearing range, 20 hertz to 20 kilohertz. Medical ultrasound range, 1 to 100 megahertz. This is both for diagnostic and treatment. So, as I mentioned before, for diagnostic imaging, this is what you could do. You could visualize inside of your body. Now, in order for the ultrasound to be safe for this baby, you have to have very little energy to cause any damage. You can't use HIFU for this particular application. So the energy is diffuse. It's diffuse, say, in a plane, very low levels, in fact, on the order of 0.1 watts per centimeter squared, and FDA regulates this. For therapeutic ultrasound, you actually take that energy that's diffuse and bring it all into a focus. So you concentrate the energy. That's the focused energy part. The intensity is getting the order of 1,000 watts per centimeter squared. Here's, I'm showing a simulation of a HIFU transducer and the beam. You can see that it gets focused here. The color, the red color, indicates the high intensity. What you could do with this concentrated energy in the tissue is you could raise the tissue temperature. This is the thermal effect of HIFU. So in this simulation, we are showing that the tissue temperature after about 1 second gets to about 70 degrees in this region, the focal region of HIFU. With that kind of temperature, this has been actually known for quite a while in hyperthermia. In 1 second of 70 degrees C, you cause coagulative necrosis. So that's what it is. And therefore, with this, by doing this, you get your therapeutic energy modality. As I mentioned before, the focus is fairly sharp. The cross-sectional area is about 1 millimeter. The longitudinal dimension is a little larger than that. It's about 10 millimeters. So it's like an elongated focus. It's a grain of a rice size, as we call it. What I will be showing here now is, again, more simulations to understand what we are dealing with of a focusing action here and what's going to happen, what the field is going to look like, what the temperature is going to be, and the lesion in the tissue, the coagulative necrosis lesion in the tissue. So let's take a look. Okay. Here we have focused beam coming, actually is steered and focusing out here. So it's non-focused here, and it's actually being steered in one direction. Let's take a look at it again, and I want to stop it so we could. All right. So right here it gets focused. So this shows the focal spot. Let's now take a look at this focal spot right here. That would be the field. You can see high acoustic pressures here and low acoustic pressures here. So with that kind of a field, what you're going to do is you're going to increase the tissue temperature, and as a result, a lesion is going to be formed. That's the principle of HIFU therapy. With that HIFU effect, you can get a biological effect. I'm sorry, I'm repeating myself, but these all go to indicate the same thing, that you can get a biological effect. The biological effect is only at the focus, and the intervening tissue is not damaged, it's unharmed. So that's how you achieve non-invasive therapy, because if I bring this HIFU transducer and put it on my skin, I'll get a focal spot coagulative necrosis in the liver, and nothing on the skin or the intervening tissue. So what are the applications? Hemostasis, that's where it all started here in the University of Washington. With my colleague, Dr. Crum, we had a grant from DOD to look at advanced trauma care for stopping bleeding using HIFU. Bleeding is a major problem not only in military but also in civilian in trauma. So for example, I'm showing here two cases. One is a liver trauma and one is a spleen trauma. You can see a huge liver laceration, and this goes immediately to the operating room. The surgeons open it up and they see the massive bleeding. They try to stop the major blood vessels by sutures, by some collagen, but the major oozing from the raw surfaces cannot be stopped. What the surgeon does is they pack the abdomen with cloth, gauze, surgical material basically, and they close the patient back up, go back in about 24 hours or 48 hours, hoping that the bleeding has stopped. And if it hasn't stopped, they have to do the same thing again. What we're hoping is to address that kind of bleeding, oozing bleeding. Spleen, we have the same problems. In fact, now it was thought that spleen does not have a very important function, so there were a lot of splenectomy of people who had actually spleen trauma. Nowadays we're realizing that in fact it does have an important function in the immune system, especially for children. So it's important to salvage the spleen. So a conservative approach is actually used nowadays. So first let's take a look at the liver application. This is a rabbit model. An incision is made in the liver. HIFU transducer is brought in, and you can see it's kept at a distance of about, for this case, 4 centimeter. So the focus is here. Now this was done in a water tank. Again, water, a good transmission medium for ultrasound. I'll show that this was the very first study that we did. And obviously this is not a surgical environment. You can't dunk the patient in a water tank to do the treatment. So let's take a look at the video. If I can get the mouse. Here we go. The incision is being made. This is what I was talking about in terms of blood and stuff. You can't quite see the bleeding because of the shadow back there, but now you can see it. The HIFU transducer is brought in, and you can see some areas of necrosed tissue. It's cooked, right? It's discolored, and that's what happens to our steak, to our when we cook it. The color changes. And to liver, which I used to eat a lot, but not anymore. All right, so remember, ask about frequency. 3.3 megahertz, that's the frequency, particular frequency we use in this case. 2,000 watts per centimeter squared. We got short hemostasis times of about a minute for incisions that were about 3 to 4 centimeter long and about 5 millimeter deep. For a rabbit, that's significant. That's profuse bleeding. You got actually profuse bleeding. And this was very effective for oozing bleeding that I mentioned is a major problem for liver trauma. We were able to stop bleeding of vessels of up to 2 millimeter. So what's the mechanism of hemostasis? Now you'll be able to tell me. It's a thermal effect, right? So we actually tested it. We put a thermocouple. I'm sorry, I'm always kissing in front of you. We put a thermocouple next to an incision, or we put it in the liver, and then we made an incision right next to the thermocouple. And here's a plot of the temperature measurement as a function of time. And we were, of course, scanning across the incision to stop the bleeding from all of the incision site. And you can see every time we passed by the thermocouple, we got a temperature surge of up to about 70 or 80 degrees. And that thermal mechanism cooks the tissue, causes coagulation, causes cautery, basically. So a thermal mechanism. What happens to tissue? We have always seen that, unfortunately, our hamburgers is not as big after we cook it. It shrinks. Water is lost. Fat is lost. So a tissue shrinkage accompanies cooking. What happens when tissue shrinks? All the blood vessels actually collapse. So we think there is a vascular collapse involved in stopping bleeding, the oozing bleeding. There's a mechanical mechanism involved too. which I'll get to a little later. But just keep in mind there's a tissue homogenization which releases a lot of tissue factors which are important for actually speeds up the coagulation cascade. We'll get into that a little later. Histologically, this is a normal liver with a portal triad. This is we see after HIFU treatment there's vascular disruption of this. This histology picture I think shows it very well. This is a central vein here, and central vein has a lot of capillaries. In liver they're called sinusoid that go to it. Normally this, when the liver is incised or has some injury, blood will come out of these capillaries into the central vein and out into the open environment of the abdomen. In a HIFU-treated case, what we are seeing is that this central vein doesn't show here, but it's blocked somewhere, maybe a little bit next to the slice of this section, and all the blood that actually was supposed to go to the central vein, it's not going there. It's actually stopped. It's like a big traffic jam. It's called sinusoidal congestion right around the central vein. I think this really shows what's happening. That vascular collapse that I was talking about, that's responsible for hemostasis. A logical question at this point would be, okay, what's going to happen to all this effect that you are causing in the tissue in the long term? We have studied that up to about 60 days in rabbits. And this is the gross anatomy. Post-op, day 1, you can see there's necrosis around it. Day 7, I think it says, and you can see the extension of the necrosis to areas distal to the incision. And why is that? Well, we have caused a lot of vessel occlusion at this site. And those vessels were probably feeding the areas, the distal areas of the incision. So all those areas become ischemic. So you can see the entire sort of distal part of the liver lobe is actually involved in necrosis. Eventually this area shrinks, the body absorbs it, as I said, that's how it works for tumors. And you can see the area is actually completely gone. There's some adhesions to the abdominal wall, which is the result of surgery. Histology shows basically the same thing, and we get scar formation at the site of the treatment. And for liver, we are fortunate enough that our liver regenerates. So we can see, in fact, new hepatocytes forming after about 14 days. 60 days, of course, shows much more pronounced liver regeneration. I'm just going to go now to spleen and go a little faster. I think I'm going too slow. As Dr. Kim was kind enough to indicate, our study for spleen hemostasis got on the cover of Journal of Trauma. One important thing that I want you to notice here is that water tank is not there anymore. We basically miniaturized the water tank around the HIFU device into this conical device. Now we have a surgical device that we could take into the operating room. It's not a water tank anymore. That's basically what I wanted to show here. You see a little different frequency. That goes to show the different tissue properties between liver and spleen. 3.3 or 3.5 that I showed for liver did not work for spleen. And also you can see the high intensity values as compared to liver, which was 2,000. Here we're dealing about 5 to 6,000 watts per centimeter squared. Histology, again, we see the effects that we saw before. We see treatment of about, again, 1 minute. The size of the incision was about the same size. We see collagen shrinkage, again, tissue shrinkage in the tissue, and some mechanical effects, as I mentioned before. It's important, it would be very important for a splenic salvage and for non-operative management of spleen trauma. Next is hemostasis of blood vessels, obviously very important. Major blood vessels going all through the body could get traumatized, and what can we do about that? Well, this is our study in superficial femoral artery of a pig. There's a needle coming in to cause injury. You can see a jet of blood coming out, the HIFU transducer coming down. and applying HIFU, shown in this schematic, and stopping the bleeding, hemostasis. I want to show you a video of now this was a puncture. I want to show you a video of a laceration of a blood vessel and HIFU treatment. What you will see is the HIFU treatment actually is moving. The reason we did that, if you remember, I said HIFU, the cross-sectional area of the HIFU focus is about 1 millimeter. The laceration was about 5 to 7 millimeter. In order to cover the entire area, to treat the entire area, we had to scan it. So we actually connected the HIFU transducer to a mechanical scanning device with a frequency of about 20 hertz and an amplitude in the order of the incision length, about 7 to 10 millimeter. And that's what you're going to see. Okay, here we go. So we didn't quite see the bleeding, start of the bleeding. Significant bleeding there because it's a laceration. You can see the blood still coming out. HIFU treatment, and then no bleeding. Just to show you the gross anatomy, arteries and major vessels, as I mentioned before, a carotid artery of the pig, jugular vein. These are large vessels. If they are injured and there's profuse bleeding, as we have had in these experiments, the patient is not going to survive. There's just a slight indication of where the incision was made. For the jugular vein, we can't even see where the incision was. And it's because of this collagen denaturation, which you can see in the form of a discoloration of the adventitia of the vessel, which basically obscures where the incision site was. So, again, looking at parameters that we always have to look at, what's happening to the vessel, what's happening to the intima. Why would that be important? Well, if you're causing if you're stopping the bleeding, are we stopping the bleeding for sure in that blood vessel? Are we occluding the vessel too? Or can the vessel still be patent after the treatment? Which would be a desirable thing, because then you wouldn't get ischemia. That means lack of nutrients and blood in the distal areas that the vessel is actually supplying. And we saw that actually intact endothelium for vessels that were large enough. If a vessel is too small, obviously we can't do that. For vessels that are large and important for supplying nutrients and blood to other areas like the femoral artery, it's important to have the vessel patent afterwards. There's a local company by the name of Theris, which actually is looking at catheter wound closure. I'll talk about this, but for them, they're looking at femoral artery, and it's important for them to keep the vessel intact after the treatment. We'll talk about that a little later. This is histology. You can see very vividly where the injury site was. This is a blow-up of this area. A fibrin plug. Fibrin is an end product of coagulation cascade. Basically has stopped the bleeding. And we can see the endothelial cells intact inside the vessel. This is the adventitia of the vessel that's coagulated and basically traps all the blood vessels all the red blood cells underneath. So these are all just small incisions and punctures. Let's get real. That's not what's going to happen. All I have to do is put my finger on the puncture site. Can we stop the bleeding from a major trauma like this, complex stellate fracture of the liver due to blunt trauma? Well, I'm showing that we can. This was done in an animal model with a high-speed impact to the liver. We got significant bleeding, 500 milliliter in about 10 minutes. That's very significant. We treated these livers with HIFU, and we got hemostasis. This is basically showing the procedure. Right after the animal was opened, after the trauma was induced, HIFU treatment of the injured areas. At the end of the treatment, this is 4 hours after the treatment, just to see if there's any rebleeding, because that could be significant. You can stop the bleeding maybe at the time, but then is it going to rebleed or not? And this is after 4 hours. You can see already some ischemic areas in the distal regions. So I'm going to actually basically sort of conclude this area of my talk by showing you a video. This is, of lung bleeding. So we got liver, spleen, now this is lung. You will see an area of the lung being cut. This would be sort of like for getting a tumor out of the lung, and you will see that device being applied to stop the bleeding. Okay, you can see the heart in the background, pumping, bleeding, and with lung we also get air leakage. So we have to get both hemostasis and pneumostasis. You see HIFU, you can see all the bubbles? That's all the air leak. That was the first pass. You can still see bubbles form. We continue applying HIFU. Now you can see what I was saying, the mechanical effect, the homogenization of the tissue, that brown stuff that you see is being formed at the tip of the HIFU. You see that? That becomes a very effective hemostatic material. And that's it. You can see the lung inflating. That means proper stoppage of the air leak, and also the bleeding has stopped. Okay, so this portion of the talk is really, I'm concluding this. This is intraoperative hemostasis, as we call it, stopping bleeding during the operation. What about guided therapy? Can we have a method where we'll be able to identify a bleeding site, say by ultrasound imaging maybe, and then treat it with HIFU, and then maybe go back and assess with imaging? Our first try at this was to use Doppler. Doppler is a good mechanism, is a good method to listen to blood flow. I don't know how many of you have seen or have heard the Doppler, ultrasound Doppler, which had the sound. We used that mechanism. We actually implemented that Doppler mechanism in the HIFU transducer, same HIFU transducer that was used for therapy. So when the focus was right on the bleeding site, we would hear that Doppler sound, and if it was not on the bleeding site, we wouldn't hear it. So we would have some sort of a audio imaging. Why do we want to do this? Well, we realized early on that if the HIFU focus was right at the bleeding site, we could stop the bleeding very fast. But that's only 1 millimeter. Our hand is shaking, everything is moving. It would be difficult to have that. And if you treated areas adjacent, sometimes we in fact aggravated the bleeding. So it's important to deliver the energy to the right spot for shortening the treatment time and in fact avoiding collateral damage. So let's hear it with Doppler. And let's see what the treatment is. So you can see the bleeding coming out. That was so. When we hear that, we apply HIFU, and then we got hemostasis. Very short, about 1 second or so. Whereas previous to this, when we were not using Doppler, we had to treat for about maybe 8 seconds, 10 seconds, sometimes 1 minute. Okay? So now that's Doppler. That works for a particular case. Could we have a more general case, an image-guided HIFU, whereas we would be able to use with imaging, which I'm showing here, an ultrasound imaging probe, to see where we are treating and then treat. This is in fact, after the treatment, you can see the areas of the liver that have been treated. Transcutaneously, non-invasively. This is the ultimate goal, of course, right? Somebody is injured at the scene of an accident. We have to go there and try to stop the bleeding there before coming to the operating room. This is what we did. We put together, in fact, an ultrasound imaging and a HIFU transducer together. We integrated them. They were sort of confocal. I'm calling them confocal, but it's really not a proper term. What I mean is that the HIFU focus was in the image plane, so we could see what's actually happening to the tissue at the treatment site. Lo and behold, we saw that, well, we can visualize the treatment site, the HIFU treatment site, and in fact becomes hyperechoic, so it gives us an indication of where we are treating. we had to synchronize this, because if we had HIFU on at all times, we would get so much interference that we won't be able to do imaging. So we had to do synchronization. And this slide basically shows that we had to turn HIFU on and off so we could get an open area where there wouldn't be interference, and that open area has to be on where the treatment is actually occurring. So how did we test this? We test this in a catheter wound closure. As I mentioned, the local company Theris is using this very method to treat patients. They have had clinical tests in Germany to show that it has worked. The same transducer assembly as I showed in the previous slide, an imaging and a HIFU transducer focusing on the femoral artery where a catheter has been going in and has actually been there for about 2 hours. So when the catheter is pulled out, there's a large hole left in the artery. With Doppler, now this is color Doppler. This is a little different than what I saw before. We'll see the flow in the channel of the catheter, in the blood vessel, and so that will actually tell us if there's bleeding or not. We treat it with HIFU, we get this bright spot. We see afterwards whether the vessel is still patent or not, and this is just a picture afterwards. So let's take a look at video. Dr. Kim, does it go to 120 or 130? 120. Okay, thank you. Okay. If I can get this. All right. All right, so you can see the catheter being pulled out. This is the imaging. The HIFU is in there. Blood coming out. This is non-invasive. Remember, we don't have the vessel exposed. So here it is. First, you can see the catheter is being pulled out. This red indicates that this is the vessel here. This is the channel. You can see the HIFU treatment of the area of where the catheter was going into the vessel. And this is the confirmation that there is no bleeding afterwards. Non-invasive, image-guided HIFU therapy. I'm going to skip this slide, these sort of slides, because I want to talk about tumor treatment. So could we use the same mechanism or same devices for treating tumors? Well, we sure hope so. For example, in this case, I'm just depicting a case that with ultrasound imaging, you will see a tumor in the uterus, and with HIFU, you'll treat it, again, non-invasively. In order for us, instead of going transabdominally, where we have to go through a lot of abdominal wall, a lot of tissue, which just makes it a little bit more difficult, and stringent requirements for energy delivery and stuff, we decided to go a transvaginal route. Transvaginal approach is both used for imaging. Is used for imaging a lot because it gives you great images, high-resolution images. So for HIFU, the same principles also hold. This is the idea of being able to visualize the tumor in the uterus, and then with imaging, and then treat it with HIFU. So I don't know why this is not. Oh, okay, sorry. This was for a class to keep everybody awake. Obviously not needed here. Oops. All right. So uterine fibroids, just a sort of a summary. It's a major problem. There are symptoms associated with it, of course, and more than half of all women develop fibroids. When I actually came across this statistic, it was quite surprising for me. And not all of them actually develop symptomatic fibroids, but a majority or a large portion of them do become symptomatic as the fibroids grow. The treatments are drugs, myomectomy, which is just removal of the fibroid itself, the tumor itself, or hysterectomy, which is removal of the entire uterus and the reproductive organs. Arthur Chan here is now an expert in this treatment because this is his thesis project. You can see this poor woman had to have a hysterectomy even though there was a little fibroid there. So maybe we can treat that and still save the reproductive potential. We did a feasibility study or efficacy study in mice, implanted tumors in them, and then treated with HIFU we saw a great response. Here you can see the control and sham animals. The tumor volume continues to grow as a function of time, whereas the HIFU-treated ones, it drops after the treatment. Excuse me. This is inoculated tumors. We have also spontaneous tumors in Ecker rats. So the tumor actually happens in situ, in their uterus. We treated these animals also with HIFU. Again, we got a very good response. This paper was just accepted for publication. Histologically, same thing. You're seeing coagulative necrosis. So you see necrosed tumor cells. Very sharp boundary between the necrosed area and the viable tumor areas. We see apoptosis or apoptosis, whatever you want to call it, in the form of these nuclear fragmentation areas in the necrosed area. This is the viable tumor area. So we got the HIFU treatment covered. As I mentioned, does it work do we have an ultrasound imaging also mechanism for visualizing fibroids? And actually it happens to be one of the best modalities for visualizing fibroids. You can't quite see it. With ultrasound, you can never see it as in a still picture as well as you can see it in the video. That's why the fibroid here, you can't really see it. But there's a faint, you can see, border to it. You have to see it in the video, in a moving case, to appreciate that you can, in fact, with ultrasound imaging, easily see a fibroid. So we put the two together. We said, well, why don't we develop a transvaginal, as I said, transvaginal image-guided, ultrasound image-guided HIFU device. And this is our vision for visualizing and treatment of the fibroid. This is the actual photograph of the device. We have tested it in vitro and in vivo. In vitro, we did the test in gels that produce this bright spot in a piece of gel. This is in vivo. Now this is this device going, of course, into the vagina and causing the treatment in this bright spot. This is an old device. Arthur Chan hopefully will graduate in June. I'm confident that he will graduate in June, and we'll show you his very exciting device in his presentation. I invite you all to come over there and see what he has done. Okay, so a question that you could all have at this point is that, well, tumor is a volume. You said that this is a grain of rice for the focal spot. How do you want to treat the entire tumor with one focus? Do you want to just put that focus with that single focus? Grain of a rice, remember. Tumors could be this big. So you put that in the center and keep applying HIFU. I wish it would work that way. It can't. You get very distorted lesions, and you get actually skin burns and tissue effects in areas that you don't want. So what you really have to do is scan that focus through the entire volume to treat the entire volume. Now, if you have what I have shown you so far, it's a HIFU transducer, say in the shape of a bowl, and a single focus. If I have a large tumor like this, what do I have to do? I have to move this transducer all over in order to get that focus to scan across the entire volume. We could do this also electronically. Instead of a single element transducer, if we have an array of elements, electronically we change the phase of these different elements for their excitation, and then we could move electronically without ever moving the transducer itself. And that's what I'm showing here. This is our 32-element annular array HIFU transducer. This is the HIFU. So the gray area that you see is the elements. So there are 32 of these rings, concentric rings. And then in the center, there is an ultrasound imaging probe. So you could put that over somebody's skin, and as I said, scan an entire area. And what we are seeing here, this is a Schlieren imaging, a way of visualizing an ultrasound beam. We are seeing focal spots from 4 centimeter away from this transducer all the way to 13 centimeter here. So you could actually step your focus. So I think actually I went fast enough to now get to the fun part maybe a little bit. This is all dandy, but you know there's a real world out there with difficulties, just as I said for trauma case. Some of the problems, I just wanted to present to you some of the problems because I know there are prospective students here. Focusing through tissue inhomogeneities. Can the focus stay nice and predictable? For example, for brain, if you want to have treat brain tumors, going through the skull is a major problem. What can you do? Because there's phase differences due to different thicknesses of the skull. What you have to do, what these folks have done, is a time reversal mirror. That means you have to put something inside the brain, maybe excited, and receive with all your array elements, see what the phase differences are, and then use that phase difference to excite the transducer to get a nice focus. Or you could do it, instead of putting something in the brain, which obviously is an invasive procedure, maybe you could do an MRI or an X-ray and get that information from those, a 3D reconstruction of the skull, and then use that information for focusing your transducer. One of the real-world problems. How about through complex structures? Liver. Dr. Cornelius Ross, who was the chairman of the anatomy department here, used to do something. He would bring students, medical students, to the front of the class and ask them the first year to draw liver, the size of the liver on their own body. And every single one of them actually drew a very small liver. Our liver is actually very large, and the majority of it is behind the rib cage. So the bone, we know we have a problem with bone in terms of transmission. So how about the areas that are behind the rib cage for treating? Well, maybe we need to dodge those. How do we dodge those? If we have a very large array, like what I'm showing here, and I'm showing the pelvis, but the same thing is, of course, true for the rib cage. And then, if there's an element right over a rib or, going through the bone, we'll turn that element off. And we'll focus basically through the intercostal space here or through open areas in the pelvis, in the case of the pelvis. Another real-world problem. So anyway, I'm concluding now that really we have a HIFU worldwide in progress. China is a pioneer in this field. At least 5 companies are involved, more than 5,000 cancer patients treated. This is quite amazing. In Europe and Japan, EDAP Technomed, Stores, our company is involved in prostate, testes, and uterus. In the United States, as I mentioned, Focus Surgery and Insight Tech are involved for different applications, and of course there are research companies. So finally, I just want to finish by this slide. Therapeutic ultrasound, I think, is on the rise. There are several applications of this, applications on this slide. We're looking at a hemostasis application here on top. We're looking at drug delivery application. Floyd Karp here is involved with for a mechanism to use ultrasound to enhance drug delivery to a vessel. And this is, as I mentioned, the prostate, the HIFU application. So watch out for therapeutic ultrasound. All right. Thank you.